Good morning, everybody. Good to see everyone from all over New Jersey coming back for the second Health Services Collaborative meeting. I'm Aaron Fickner, president of the Council of County Colleges, and it is so good to see so many people from so many different organizations coming together to continue this important work. I'd like to introduce our partner, Michelle Sekurka from NJBIA. Michelle, thank you for being with us this morning. Good morning. Michelle, I think, is with us.
Thank you. I had to be
Michelle,
unmuted.
Welcome and good morning. Good to see you. Thank you for being a great partner and happy spring.
Thanks, Aaron. Apologize. Your team did a great job of keeping us all quiet on the other side. So here we are. Good morning, everyone. Pleasure to partner with our partners at the Council of Community Colleges on this extremely important initiative. And, we spent last week hearing from our business colleagues on their take on the needs, on what they're seeing in real time, and now being able to marry that up to the delivery side. And to understand where your opportunities and challenges lie in meeting some of those needs is the exact place we need to be, sitting at the center of the table, bringing all these dynamic organizations together in order to establish these pathways, get obstacles out of the way, and create opportunities for everyone. So Aaron and team, it's NJBIA's pleasure to be a partner. And I just want to say thank you to each and every one of you who are taking time to be part of this very, very important process. So Aaron, I'll throw it back to you.
Great. Thank you, Michelle. And as Michelle said, we had incredible discussions you'll hear about later with industry leaders that BIA helped us bring together from all elements of the health services industry and our three other industries. And so this work is beginning in new and innovative ways. So great to see everybody here this morning. We have a full program again for the collaborative meetings. We're going to start, the theme of today's meetings is industry valued credentials and stackable pathways. As you know, and we've talked about this so many times, and as Michelle alluded to, this whole effort is obviously about building pathways. And that is ensuring that we are providing opportunities for people of all ages to move from one educational institution, one training and education experience to another, always moving up the ladder, always getting more education that is stackable. We know that for so many of our students and so many of our residents in New Jersey, they will continue to need multiple pathways, the ability to come on and off ramps, always aligned with the needs of industry. And so today's theme that we will explore in a couple of ways is industry valued credentials and their role in creating stackable pathways. So we're going to start this morning with some quick presentation and a discussion from two phenomenal national experts on the issues of credentials. And I am honored to be joined by two really thoughtful leaders from very different perspectives. And following this intro panel, we will then do a spotlight on an interesting, innovative pathway partnership run at Bergen Community College that I think will inspire and make us all think differently about how we work together. We will then share some insights on the current industry trends from the industry leadership team meetings that Michelle mentioned. And then we'll talk about the sector pathways model that we're developing through this initiative. So again, thank you all for being with us this morning. So with that, I'd like to introduce our initial panel. So excited to have our friends at the American Association of Community Colleges represented in John Dyer, the Assistant Vice President for Workforce Development. John has been with AACC for about 7 years, and prior to that worked in community colleges, worked at White Mountains Community College in New Hampshire in a variety of workforce and corporate relations roles. So John brings not only that strong community college experience, but also this national perspective. And as many of you know, AACC has been doing some phenomenal work nationally, bringing community colleges together to think differently about workforce development and the role of industry-driven pathways in a comprehensive community college system. And also very honored to have Betsy Tessler from MDRC, a senior research associate. For those of you who don't know, I encourage you to take a look at the phenomenal work that MDRC does every day. MDRC is a nonprofit research organization headquartered in New York City. It's had a long history of doing phenomenally rigorous and insightful research and evaluation on a whole range of economic mobility, economic opportunity, and workforce development work. MDRC has been partnering with our council on a variety of different initiatives. So Betsy, thank you for being here with us and for being a great partner with our community colleges in New Jersey. And again, I encourage all of you to take a look at MDRC's research on their website. It's a lot of really great findings. So we're going to start with short presentations from John and Betsy with their general thoughts about credentials. And then we're going to dive into some deeper questions about where we go from here. And we'll open up the floor for questions in the chat. So if you've got questions for John and Betsy, please put them in the chat. But looking forward to an interesting conversation with two people with a strong background in this area. So John, let me start with you and give you the floor for a few minutes to talk about the AACC perspective on credentials and pathways, and give us your thinking on the kinds of things that we should be thinking about here in New Jersey as we launch this ambitious Pathways initiative. So John, good to see you this morning. Betsy, good to see you. And John, the floor is yours.
Thank you, Aaron. Good morning, everyone. As Aaron said, I worked on a campus for many years. Now I sit 3 days a week in an office in Washington, D.C., and 2 days a week in my little office at home. But I will tell you, my heart always is on a campus with those of you who are actually doing the real work every day, day in, day out. The field is where it's at as far as I'm concerned. So I salute you all and thank you for the opportunity. New Jersey's been doing some amazing work. We started learning more in depth about it about 2 years ago when we worked with Aaron on a project that had to do with recovering and reskilling during the pandemic. And we're blown away by the ambition and the excitement and energy going on in New Jersey. So frankly, it's a great privilege for me to be here with you all today. And I suspect I'm going to walk away with a lot more from the conversation than you will. But I'll do my best to give you some initial thoughts. I want to start by talking about what a credential is from our perspective. This may sound pretty basic, but bear with me if you will. Fundamentally, a credential should say something about what a credential holder knows and what a credential holder can do. Simple enough. I would take it a step further, though, and say that what it is that a credential holder knows and what a credential holder can do is only useful if that can be clearly articulated by three different groups. The first is the institution that grants the credential. If you can't, at a college, clearly articulate what that credential represents in terms of specific things a credential holder knows and specific things a credential holder can do, then you're doing yourselves and you're doing the credential holder a disservice. The second group that needs to understand and be able to clearly articulate those two things is the credential holder herself. She needs to be able to clearly say, this is what I know and this is what I can do, and this credential accurately reflects that. The third group, and arguably the most important, is the employer community. If an employer is presented with a credential and they don't clearly understand exactly what it represents in terms of what the credential holder knows and can do, then it's functionally a piece of paper or a digital badge that has no particular value. The classic example when I think of credentialing in healthcare is the NCLEX. The NCLEX is widely established across the United States. I think every state requires the NCLEX. I think employers understand what it represents. I think nursing students understand what it represents. And while not every single person on a campus might be able to articulate exactly what every nursing student that passes the NCLEX knows and can do, I think there's a broad understanding of what that represents. I don't think there's a lot of confusion. Let me draw a contrast. As a thought experiment, just for fun this morning, I went to Google and I typed in medical assistant certification. I skipped past the first 2 or 3 entries that were clearly ads, and I clicked on the first link that had EDU in it. That is to say, it was an educational institution that had something about medical assistant certification. I won't identify where it was except to say that I don't believe it was in New Jersey. They then, on this link, told me there were 3 different medical assistant certifications that they offered, each from a different organization. And each was accompanied by a whole lot of jargon that I, as somebody who conceivably should understand what a certification is about, struggle to understand. If I'm a student who thinks maybe I'd like to get a medical certification, imagine if I clicked on that link and was confronted with 3 choices that I didn't understand. And if I'm an employer, maybe somebody working in HR who is not a specialist in medical assistant certifications, imagine my struggle to understand, well, which one of these do we want? If I'm a faculty member or an administrator at school, how do I decide which one is the appropriate one for my institution to offer? It's a problem that is not limited to healthcare. It's not limited to any particular field. Certificates are hot. Lots of people want to offer them. Digital badges are hot. Lots of people wanted to offer them. And so understanding what they are, what they represent, and gaining some common sort of nomenclature between employers, between students, between institutions, between workforce boards, between other community-based organizations, everybody that's involved in workforce development, if everybody understands exactly what it is, life just got a whole lot easier. And imagine when it comes time that somebody arrives on your doorstep at a community college holding that certification, you don't have to worry about, well, what are we going to use prior learning assessment for? We know exactly what this credential represents. We know exactly the courses that we offered that lead to that credential, so we can clearly just go ahead and award credit for those classes. And you've saved a whole lot of time and angst and struggle. So I would argue, just as an opening gambit, that the key thing to understand about credential is the need for transparency about what they are, to make them articulable, and to view them as a currency. My final point I will make is this. I think credentials we look at often as a ceiling, as sort of the accomplishment that is the pièce de résistance after a certain amount of training. I think that's great. I also think it's wrong. I think we ought to look at them as a floor. If you look at a credential as a floor, you can now say every credential holder can do A, B, and C. There may be some credential holders who were top students or who were particularly ambitious who can also do D and E. But if we understand that even that student who graduated last in his class and still earned the credential can still do A, B, and C, now we can much more clearly articulate to employers, to the community, exactly what it is that we have on offer. And I will say this, I envision a day when every degree and certificate program at a community college that isn't, say, a general studies transfer degree, but every other one that leads potentially to a job carries with it an industry recognized certification. And I'll stop there.
John, thank you very much for leading us, kicking us off, and couldn't agree more with your final point, which is a major goal of this entire initiative. So let's turn it to you, Betsy. Betsy, you've been doing some interesting research and evaluation work for housing and urban development and looking at family self-sufficiency and how to help people move out of poverty. How do you think about credentials in your work at MDRC and any reflections you have for us as we embark on this initiative?
Thanks, Aaron, and hello, everyone. I'm happy to join you from my home office in Essex County, New Jersey. So since I'm coming from that research and evaluation perspective, I'm going to start by talking a little bit about what we know and what we don't know about these kinds of short-term industry-focused credentials, especially the non-credit credentials, and a little bit about stackable pathways, and hopefully offer some food for thought as you consider how to better create, expand, promote, and use your post-secondary education ecosystem here in New Jersey, and especially in a way that will advance equity for New Jersey citizens. So a lot of what we know about industry credential training comes from evaluations of sector strategies, which you may be familiar with. Some big evaluations of sector strategies include Work Advance, Project Quest, the PACE evaluation, which is Pathways for Advancing Careers in Education, and HPOG, which I assume most people are familiar with, Health Professions Opportunity Grants, to name a few. So these are short-term sector-focused occupational skills training programs, but they have other key elements that research suggests are essential to their effectiveness, including job readiness training, or what we might call soft skills or professional skills development, support services like transportation assistance, referrals to services to address other kinds of barriers to training and employment, assistance with job searches or job placement, and sometimes continued services to participants after they find a job to help them advance. All of these services are linked to the targeted sectors, including the soft skills or professional skills development. So as an example, most of the programs involved in HPOG offered soft skills training that specifically emphasized how to interact in a healthcare setting. Almost all of these sector strategy programs, again, focused on short-term skills training and credentials. Almost all of these programs that have been evaluated either covered all or part of the cost of training, or helped participants apply for financial aid. Many of these evaluated sector programs were implemented by nonprofit community-based organizations, but often those were in partnership with community colleges. And of course, many community colleges are already incorporating some of these other features. So not just the skills training, but these other features that are found in these evidence-based sectoral training programs, being responsive to local industry needs, offering classes in a cohort structure, which we found helps lead to effectiveness. Having dedicated recruitment staff and case managers who can support students to remain engaged and complete their programs. So while the overall employment and earnings effects of these kinds of sector programs are mixed, they have been shown to be effective at helping participants complete their skills training, obtain their credentials, and find initial jobs in the target sector. So that initial target sector job is really key. And that is because evidence from multiple studies suggests that these kinds of credential programs, occupational skills training programs, generally have one chance to train students for a job in a high growth industry to help them get their foot in the door so they can advance on the job. From what we know, and there's a lot we don't know, and I'll get to that, most people do not come back for additional training in what we think of as the stackable credential model, at least not training that leads to a change in a job title, which I think is how we typically think about career advancement. So for example, findings from the HPOG study showed that within the first 3 years following study enrollment, less than 10% of participants attended a second training program after completing their initial training and finding a job. So it was mostly first rung training, first rung jobs, which is not surprising when we think of how disruptive it can be to keep going in and out of work and training, and also managing childcare for, especially in the healthcare industry, which tends to skew towards women. So how do community colleges and other skills training programs take people with relatively low educational attainment, train them for a well-paying middle skill job in a high growth industry in a very short time? Not easy. MDRC has found that to really train people for middle skill jobs, community colleges and other programs have to be fairly selective in their screening when considering who has the skills to succeed in these kinds of training programs. In fact, this is one of the criticisms of these effective sector programs, that there's a very extensive screening process. The alternative is being less selective and more open to more people of different skill level, in which case the training is more likely to lead to more entry-level jobs. So in that case, embedding some coaching in the training around how to advance on the job once someone is employed could help set people up to try to gain additional skills on the job and maybe to pursue additional training and credentials down the road. So this leads to what we don't know. From what MDRC has gathered through the increasing number of studies we're conducting on workforce training programs in the community college setting, data on short-term industry-focused programs, especially those that are non-credit, are severely lacking. The data in the non-credit credential training arena are so lacking that we don't really know whether people attempt to stack credentials, whether they succeed, or what the labor market payoff is. There are not a lot of data out there to tell us whether people who complete even one short-term training program, especially non-credit ones, are working at what kind of wages and what kinds of jobs, let alone whether they go back to complete additional credentials or academic programs. So I'll end with a few questions to consider as you discuss building out your post-secondary education ecosystem. Who are you aiming to recruit into these short-term credential programs? Who do you want to be able to move along stackable credential pathways? If by definition these are working people or will eventually be working people, and if you're expecting them to go back to school for additional training and credentials, what types of supports will they need to be successful? And how will colleges provide those supports? What other ways might colleges change how they deliver these programs to be more accommodating to the population of people you are hoping to train? And if, as the evidence seems to suggest, you have one chance at getting people the skill training they need to be successful and to meet employer needs, how will you use that time to set them up to be able to advance in the future? And how will you collect the data needed to be able to determine whether this model is working, both in terms of labor market outcomes and continuing education and training outcomes? Thank you.
Thank you, Beth.
Aaron, can I ask a question?
Of course, Michelle.
And I know data is lacking, but do we have any idea of where the population lies in the certification programs? So in other words, how much of the population is immediate post K-12? How many is more adult learner? Do we have it by age groups? And then is there any other census type of data to lay over that? I understand you said data is missing. Is that the type of data you're saying is missing to understand how you address the different audiences? Or do we have that type of data to know who's really the population taking advantage of this training, and or where's the sweet spot for this training?
John and Betsy, do you want to tackle that question for Michelle?
Well,
go ahead, Betsy.
Well, I was going to say, John, you probably have a better handle on that than I do. I would imagine that there are more data for folks who are, currently in your colleges and in the training programs. Where we understand there's a lack of data is after completion to be able to follow labor market outcomes and continuing credential attainment. But John, you can probably speak better to that than I can.
Oh, I was going to lead off by deferring to you, but okay. So I think the data on credit-bearing programs are significantly better than the data on non-credit, which are largely non-existent. The data on credentials offered, particularly industry-recognized credentials offered, are abysmal. They're sometimes better within a region or a state, but from a national perspective, there's almost no way to wrap one's head around it effectively. I could spend all morning talking about the challenges we face with, I don't need to tell you all about how bad iPads is as a tool if you work on a community college. We use a tool called the Voluntary Framework of Accountability that some colleges have signed up for that we think is a better measure of how students move through their educational progression. But by and large, to get back to your original question, I just think the data are bad overall. And by bad, I don't mean that they necessarily always indicate bad outcomes, but just that it's not aggregated. No one is aggregating in a way that could prove useful for those of you who are practitioners in the field.
And so as we launch this initiative, I think, these are the kinds of questions that we've got to be committed. The question that Michelle raised about the broader population and what does the New Jersey population look like that we need to help. And I would agree with what John and Betsy said. There's not enough information about what credentials people currently hold that could help us make those planning determinations. And then there's the second set of data, which is what are our colleges and our partners doing? We've got some work to do there, as John and Betsy said. And then finally, what's industry need? And I think those are the three kind of levels of data that we need to continue to commit to do a better job of bringing to the table. But this is a good initial discussion to kind of ferret out the needs and the reality. And I want to kind of add on to kind of what Michelle is getting to, and Michelle, your opening remarks, and clearly, and John, you did a good job of laying out the three groups that need to kind of buy in and understand credentials. And the third group you mentioned was employers. We know there's been a proliferation of credentialing. Now, obviously, maybe not so much in healthcare, though, John, you gave us a good example of an occupation that may have a variety of different credential options. But as you do research, Betsy, and as you, John, look at policy across the country, what do we need to be thinking about in terms of this broader question about quality of credentials? Knowing that there's been a proliferation, and how do we better understand what credentials should be part of our pathways, should be the credentials that will lead to better outcomes. So any thoughts on how we might tackle this issue of quality of credentials? Obviously, not every occupational training program is equal to every other. So John, why don't we start with you? Thoughts you might have, kind of riffing off what you said at the beginning about how we might think about quality credentials.
Well, so I'll say something that may brand me as a heretic coming from the community college side of things. But I think really the group that's going to decide what the quality is of a given credential is the employer community. They're either going to value it or they aren't. And you'll know whether they value it or not, depending on whether your credential holders are employed or not, or whether they're employed and then immediately let go shortly thereafter. That said, I mean, that's a bit of a glib response. But at the same time, if an employer doesn't understand what that credential represents in the first place, then shame on all of you, because now you're training for a credential that nobody understands and nobody has really decided what the quality is. Let me give you a bit of an example that I think is a little different. Aacc ran a project a number of years, well, feels like a number of years ago, but I guess it wasn't that long ago, called The Right Signals, that was focused particularly on credentialing transparency. And we worked with 20 colleges from around the country. And one of those colleges in Ohio started with their employers. They were working in tier 3 manufacturing. So they were working with mostly job shops that were building parts for auto manufacturers. So they were building parts that went on to other factories that then went on to the people who were assembling them into automobiles. And they realized that they didn't really understand how to credential. And they also realized that employers didn't really know they knew what they wanted, but they weren't able to clearly articulate what they wanted. So rather than starting with the credential, they actually sat down with the HR people at these smaller manufacturers, and I think this is key, with people actually working on the shop floor, and said, tell me what it is that you do. What do you do every day? And began to work up a profile. And from there, the college actually helped the HR department write all the job descriptions. So now you can write specific competencies, specific skills right into a job description. You can match curriculum to that, and then you can identify that certificate that represents those skills, competencies, and knowledge. So that's a lot more labor intensive. But the only way in my mind to identify whether a credential of some kind or other has value is if everyone understands what it represents in the first place and the employer is able to clearly articulate what it is that they need. And meaning no disrespect at all to HR people who are perennially underappreciated, I think. The reality is that they don't always have the best take on what it is that's required of a given person in a given position. I mean, we all have phrases in our job description that say things like other duties is assigned for a reason. It's because nobody can really articulate what it is that we do on a day-to-day basis. So I think that if you're going to start with quality, you have to start a quality credential. You have to start way further back and start with what it is actually that you expect people to do in their jobs, and then go from there.
Great, thanks, John. And Betsy, when you look at the research literature on the sector strategy work, is there any insights about how we might address this issue of credential quality, knowing that not every training program is equal? Thoughts on that broad topic?
Yeah, so I was going to start just where John did, that really, the value is attributed by trainees' ability to find work and be hired, and that it's really the employer community that will determine the value of a credential. One of the things that we've been trying to think about at MDRC in terms of value of credentials is how narrowly or broadly focused they are. Kind of what is the goal for their credential? We've seen many programs that are focused on nationally recognized, industry recognized credentials where someone could, obtain the credential, work and move somewhere else, to a different region, a different state, and be able to use that credential there. There are many programs that focus much more narrowly on specific employer needs. It's not there are programs that offer credentials that are not nationally recognized. They're really very tailored, customized to particular employers. What we've been kind of struggling with or trying to figure out is, what is the trade-off in a really narrowly focused credential? Let's say an accelerated program that is very focused on very specific needs, and then when the labor market changes, the economy changes, where is that person left with that credential? So we often talk about training programs being able to be nimble, community college programs being able to be nimble to shift and adjust the trainings that are offered based on industry demand and based on a changing economy. How do we address making sure that our workers are nimble? So if we focus training too broadly, the training may take too long, and students may not complete, and then that's not a good outcome. If we focus too narrowly, then that individual worker may not be nimble enough to shift. So these are some of the kinds of things that we're thinking about. That doesn't really answer your question about what makes a quality program, but I just offer that as another thing to consider.
Yeah, thank you for both of your perspectives, and you're raising the bar on our thinking here in New Jersey and giving us a lot to think about as we go forward, and a lot of the work that we're going to need to build to help support this broader initiative. Betsy, let me stay with you. You talked a lot in your opening remarks about kind of the other support services that are part of Pathways, and you've done a lot of research on that. So as we think about, building pathways with a focus on equity and opening up doors of opportunity, what are some pieces of advice, for all of us that we really need to think about? I'm really left with your point about how few people continue to get more education down the road, and how we might try to address that through industry partnerships or the like. Elaborate a little bit, if you could, on some of your findings around advice that might be relevant to us as we think about building out these pathways that could address some of these equity gaps and open up opportunities for more people.
Sure. One thing that I'll say relates back to, I think, some of your opening remarks, John, which is, I think you need to think about how people come into to these programs and what they do after they move out. So one thing I was thinking, John, when you were initially speaking, is another thing that MDRC, another finding from our work, from MDRC's work, is that there's a lack of advising coming into, there's often a lack of advising coming into these credential programs. So we often hear that, especially for people, I mean, many people come in not looking for advice, they're working already and they need a very particular certificate. They need OSHA training and they know exactly what they need for their job. So they come in. But there's another group of people who come into training programs not without good advice. Maybe they know somebody who's working in some field and they think that that's going to be the right fit for them. So thinking about advising and active recruiting to identify the folks that you want to bring in to these programs. So unemployed, underemployed populations may need some active recruitment. So how can programs, how can the colleges get into communities and let folks know what's available? So that's one thing. Support moving through the programs, we have found in our studies, is really an essential piece. So it's sometimes hard to tease out what are the factors that lead to success, right? So when we do rigorous evaluations and randomized control trials of sector programs, they're a package. They include the occupational skills training and a lot of the supports. The qualitative research that we have done suggests that the supports are a very essential piece. Everything from, as I mentioned, some kind of financial supports that people may need. They have to be able to get to their classes. They have to have the right kinds of equipment or clothing for their job interviews. People may need assistance with childcare. They may have legal issues, housing issues, mental health issues. How much support can we provide to folks to make sure they can remain engaged, complete their training, obtain their credentials, find the job? So those pieces we have found are really essential, although we can't definitively say exactly which piece is behind the effectiveness that we find in many of these programs. And then the other piece that just seems, again, from our work with community colleges, it just seems like a very difficult nut to crack, is maintaining some kind of contact with folks after they complete, and trying to follow up with them and be available for people who, once they're working for some period of time, to make sure they are successful on the job, they remain in the job, and understand opportunities they have to advance, which could either be obtaining additional credentials, or even just understanding how to negotiate on the job for a promotion or for a change in responsibility. I think we need, when we think about career pathways and career ladders, we have to think about advancement maybe more broadly than simply gaining additional credentials and getting a different job title. You know, how can somebody obtain better benefits, a more steady, you know, more steady schedule, you know, slowly have more responsibility on the job. So these are the other pieces outside of just the skills training and credential attainment that are important, but I understand are a little more challenging to provide.
Betsy, thank you so much for raising all of these important issues. John, let me give you the last word. You know, and I think we're a little bit over time here in this really interesting initial panel. So thank you for all of you. It looks like there's a really active discussion in the chat. So encourage everyone on the line to jump into those discussions as well. But John, you know, as you looked at efforts around the country to build broader pathways between community colleges and high schools and four-year colleges and all of that, you know, are there some pieces of advice that you want to leave us with today as we think about the work that we're doing here in New Jersey?
I'm not sure you need advice. I think you're actually probably a lot further along than you probably are giving yourselves credit for. I think the work you're doing is inspiring, and I think a lot of other states are going to watch you. But let me throw out just a couple ideas that I've seen that have some, I think, potentially some promise. One of the classic ones that I've only seen in a few places, surprisingly to me, has to do with Perkins Funding. So for those of you who are familiar with Perkins Funding, know that it's used to help support CTE programs at the secondary and post-secondary level. Different states have different rules for how it's used, but generally speaking, any program that receives Perkins Funding has to have some kind of an industry advisory board, just like all the community college programs have advisory boards. What I've seen in a couple of places is an industry advisory board that the same board serving both secondary and post-secondary. Now, if you have the same people at the table for both those conversations, one, you've done something really important by asking industry people to go to one less meeting, and don't underappreciate the value of that. Second of all, now you know that secondary and post-secondary are getting the same input about the same industry needs consistently, which provides you an opportunity to really think about stackability and what's needed in a variety of ways. The other model that's out there, if you want to go to the other extreme, that I think, I'm not sure many states would embrace it, but it's hard to argue that it has some advantages, is what Florida did. Florida said a number of years ago, the legislature said to the community colleges, universal transfer. And then it said, thou shalt. It wasn't something to be negotiated with community colleges. Essentially, course numbering and transfer and course competencies are mandatory between and among the institutions in Florida. Now, I'm not suggesting that you all call up your legislators and suggest that they make that happen. But voluntary agreements between institutions that says, this is the floor of what this course represents. This is the floor of what this certification represents. You've just made transfer for your students a whole heck of a lot easier. You've taken uncertainty out of faculty calculations, and everything, I think, can benefit from that if you can find a way to get there. And I'm not necessarily recommending you ask the legislature to step in, but there are some real benefits for students, for employers, and for institutions in looking at that kind of a model. So, and I'll just, if I can offer one last thought based on what Ben said earlier, I think it's critical that you treat students as holistic entities that have needs above and beyond training for a specific career. Thanks.
Thank you, John. Thank you so much, Betsy. Both of you been phenomenal this morning, kicking us off for our week of collaboratives meetings. And John will be back on Friday for a discussion in our manufacturing supply chain work. And Betsy has agreed to come back on Thursday for our energy and infrastructure discussion. We got 2 other phenomenal speakers that are going to be layered in throughout the week. So thank you both for giving us a lot to think about this morning. I think it shows me that we're heading in a good direction, but a lot that we can learn from the 2 of you. We will be sharing some links to research and resources from John and Betsy with all of you after the meeting. But thank you to our great speakers. And I know all of the folks on the line join me in thanking you, Betsy and John, for inspiring us and giving us things to think about, things to work on. And John, we're committed to being that national state leader, but we're still willing and open to learning from everybody and anyone. So thank you for making those connections. And Betsy, thank you for bringing a research and rigorous evaluation perspective to our work. Look forward to seeing you both later in the week and to being in touch with you both. Thank you very much. So with that, I'd like to introduce Sandra Blechman, who is our Director of Health Services here at the consortium leading our pathways work in health services. Good to see you, Sandra. And the floor is yours for the next part of our program.
Thank you, Aaron. Good morning. As Aaron said, I'm Sandra Blechman. I'm the Director of the Health Services Strategy and Workforce Partnerships. I also wanted to introduce Stephanie Samuel, who is our Program Manager for Health Services, as well as Infrastructure and Energy. So Stephanie, just give a wave. Thank you all for being here. John and Betsy, as you can tell, you hit a lot of points. We had a very active chat and discussion. We probably could have kept you here all day. But we are really excited about the next segment. And this is a segment, if you were not here at the first session, we will have every month where we really want to highlight those innovative partnerships with our partners. As we heard, industry is so important. So today we have from Bergen Community College talking about their pharmacy technician program, Susan Bernard, who is the Dean of the Division of Health Professions, as well as Maida Gonzalez-Bosch, who's the Associate Dean, the Division of Health Professions. So Susan and Maida, we're really happy to have you here with us today. Also, for anyone that has a question for Susan and Maida, please put the questions in the chat and we will answer them as time allows. Thank you so much for being here with us. Susan, I think you're still muted. Let's see.
Good morning, everybody, and thanks for joining us this morning. We appreciate the opportunity to share with you an opportunity that has come about at Bergen. And so Maida Gonzalez-Bosch is with me. Dr. Bosch is the Associate Dean for Health Professions, Continuing Ed and Workforce Development, and we work very closely together. And so can we have the next slide, please? So as we move into kind of what shapes healthcare education and credentialing, we know that we have a lot of partners that we have to engage throughout the process to get that candidate, that individual to the workforce and to be one of your employees. And first starts the accreditation. And that is ensuring that we meet specific guidelines as outlined by specific industries or specific professions that guide the curriculum and make sure that we are providing the foundation for students to be able to pass credentialing exams as well as meet entry level for the profession of their choice. But what's very important in that accreditation, as we've been talking about this morning, is those partnerships with industry. Because the reality is that when a student starts at one of our programs or any of the healthcare programs, they're going to start their clinical experiences. They're going to be going to really an interview that can last anywhere from a year to 2. And then many are offered positions after they finish. And so employers are a really important portion of shaping the future trends within all of our curricula, both credit and non-credit. Now, all of our credit programs must have industry-based, and many times these are our clinical affiliates, plus some others within the industry that really help us to shape the future of the curriculum. Then we have our credentialing. So those are exams that students have to take after they've finished that foundational preparation, and then must note to a credentialing agency that they have that accountability to that foundational knowledge to be able to earn their credential. Next comes the licensing, and then they apply to the state. And as I saw in the, that's really something with portability of licensure. Some professions have a national standard, some have regional, some have that it's only one state, because the scopes of practice that occur within each of the areas regionally really changes from profession to profession. And then we have the regulatory, and those can be your state boards, those can be your continuing education and ways in which you enhance the practice, advancing your credentials, those kinds of things to be able to move forward. So it really is a partnership between the employers, between the accreditors, between our Division of Consumer Affairs and our credentialing bodies to guide and provide that foundation to students and graduates to be able to enter their area of interest and that they have a passion that they want to practice. So in looking at that, we want to present today, and I'm going to go over to Maida in just a second, one of the opportunities that we have had through the HealthWorks grant, the apprenticeship grant, that Maida has developed in relation to pharmacy technician. So Maida, do you want to take that next slide, please?
Hello all. Thank you, Sandra, for the introduction, and Susan as well. Yes, today I want to mention and go over the model that we create here at Bergen, working together with the HealthWorks grant apprenticeship that was just looking for opportunities and connection, and we start working with our partner CVS. But before I start just reviewing the model that I created, I want to mention and talk a little bit about our pharmacy technician program. Our pharmacy technician program started in 2014, July 2014, at Bergen Community College. We were working all the time in collaboration with the health profession, credit side, our Dean of Health Profession, Susan, and we also work with the PPCB board, Pharmacy Technician Certification Board, recognize our program as a recognized training. The program is offered a health profession integrating teaching center at the Health Profession Integrating Teaching Center, and prepare our students to work in the health profession field and also work in a retail pharmacy. Is an excellent opportunity for our students, and we had a great acceptance for our students back in 2014. But the program now collaborates with the HealthWorks Apprenticeship Grant and CVS as our primary partner or principal partner, and we develop our model. The apprenticeship, next slide, please. The model that we create with CVS, we start working with them in 2019. And as you know, after we start working with our partners in the apprenticeship model, CVS was one of our first and principal partners in the pharmacy technician apprenticeship idea. Next slide, please. Then we start brainstorming, because most of the time when you are working with employers, you need to make sure you're working from day number one with them. And then we, in July 2020, we start working in this idea. We want to start and run our first cohort with a grant, with the HealthWorks apprenticeship grant. And then we need to start looking for students, and we need to evolve because it was the pandemic era. Then we need to start using technology, virtual a lot. And then we start using and create our information sessions, virtual information sessions. And our first virtual information session was the one that started helping us to find students for the program. We evolve as well with the recruiting process because we need to do interviews and math exam because they need to have a specific grade in the math exam. And the Grand Successful Coach was working with me all the time, helping with the information session and with the math exam. We face a problem. How are we going to be doing a math exam if everyone was working from home and we were during the pandemic 2020? Then we start using Google. We create a Google exam, and the Successful Coach was using WebEx to proctor each candidate to make sure they pass and they have the right grade to start the training. Then after that, in the model that I create, we decide to review the resume. The student's resume was a key to make sure we have students ready to apply for a position even before they start the training, because it's important to know that they are the right fit for the institution. And we invite to participate in the interview process our partner CVS. CVS participate together with the Bergen team in the interview process, and then after they select the right students, we start our first cohort in October 2020. After students start, they will be taking an Rti training around 12 hours, where we include in the dynamic portion of the training a PPCV review preparation, because we want to make sure when they finish, they pass their PPCV examination or certification exam. When the students pass their certification at the same time during the didactic training, they will be taking 2 trainings with CVS. One of the training is customer service and culture, soft skills, where the CVS partners are just sharing with them the expectations and what they are looking for in their employees. And the second training that was part as well of the related technical instruction is the application process, because we want our students get hired, but they need to go through the application process CVS require for all their applicants. Then the students take all these trainings, and then when they finish their RTI, they are ready to go. And they already complete the application process and they know if they're going to start working. Most of the time, they start working immediately. The PDCB exam is a very challenging exam. Then we want to make sure to ask the students to complete their registration and take the exam as soon as possible, because they have all the information fresh. And our main goal is just to help the students to move forward in the health profession field. Apprentices are hired, and then they need to start and follow the apprenticeship model. They need to start their own job learning, or JL. Training that will be happening with a mentor-mentee program, where the mentor-mentee program will have 1 mentor for 2 mentees. And as you can see, at the beginning, we didn't have anything. The grant team was very helpful, and we worked together just to find an idea. When I run the first cohort in October 2020, we were very exciting to see when we put all the pieces together, that our work was happening, and our students were finding a way and a connection just to complete their training, their certification exam, and start working with CVS, our partner. Next slide, please. Then, as you can see here, so far we are in cohort 5. We have the possibility of 9 students to be hired. The last cohort is ongoing. We are working because the cohort will be finishing in April. In October, we have 12 apprentices, 4 were hired by CVS, 6 took the exam. We have students already certified. They have the opportunity to apply. And if they are not passing the application process, they have the opportunity to keep working with our successful coach and reapply 2 months after their first application with CVS, if they want to do it. Then, as you can see, they have more possibilities, and we still have a pool of students working. We're working with them even for example, where we have 10 students, 5 students were hired, and then we are our successful coach. It's fantastic here at Bergen. She's still working with the students, helping them, training them, assisting them just to make their hiring process happen. We are working with them until they start work. But our main focus, as I mentioned before, is just to ask the students to complete their PTCB exam as soon as they finish, because we want them certified. I think it's a plus for these students, and I think it's a fantastic opportunity for them to finish and be certified after they finish board training. Next slide, please. If you have any question, please feel free to contact me, contact Susan. We're more than happy to help you, more than happy to assist you. And of course, if you have any question now for us, we can answer if we have the answer.
We do have questions for you,
Okay.
of course. Thank you so much. This is such an innovative program, and you really overcame the challenges, as you mentioned, Maida, during COVID, right? We have to be creative. We have to adapt to this changing, environment that we're in. So one of the first questions is there an avenue for pharmacy tech students to continue to pursue a degree and credentials as a licensed pharmacist?
Susan, maybe you have an answer for this one.
Yeah, not necessarily a direct. So certainly the experience, and if they have the passion to move into that area, oftentimes it may be something that they were encouraged to do, and then they find that they really like it. So then they move on to take their general education classes, but a pharmacy assistant is not it's a roundabout pathway, but not a direct pathway to an advanced degree that pharmacy is.
Okay, great. Thank you, Susan. Another question, what happens when applicants do not pass the selection process? And we talked a lot about support services and wraparound services. Is there counseling or coaching for alternate vocational or educational opportunities?
Yes, I'm gonna take this one. The grant include a successful coach. And the successful coach is working with all these students, and sometimes they apply for pharmacy tech, but in the way they realize math is not for them, or they realize that exist other opportunities for them, then the successful coach is working with them all the time just to give them some advices and just to guide them in another direction, just in case will be the reality for the students. And we have students that they are coming to us just to do pharmacy technician, and then they say, you know what, I want to do CNA because maybe later on I'm gonna move forward to PCT, and I'm more focusing caring. I'm more focused about clinical and doing things with patients. And we have students that they realize later on that they want to follow another training and they want to take another avenue for their education. Yes.
Thank you. See, the questions are just rolling in now. Okay, where do the students who passed the exam and were not hired by CVS go?
Yes, that's another good question. Our successful coach is working with our job placement manager, and any student that they apply and they are not passing, they decide to move forward in another direction. The successful coach is passing the information to our job place manager at the Division of Continuing Education, and then he is working with them all the time. When they pass the PCB exam, that is a key. They have a lot of opportunities out there, and they can apply with another partners. And we have partners all the time, other partners that are looking for pharmacy technicians, and they can have a place in another places. It's pretty easy because it's on demand right now. Yes.
Terrific, thank you. And I think just in speaking with your relationship with CVS, how did you start that partnership and build it? Because it's so critical, right? To be able to listen to industry needs and build those partnerships. So how did that work, Maida?
I have to mention the partnership start before even Bergen won the HealthWare grant, apprenticeship grant in 2019. We start conversation with CVS. We knew we apply for that grant, and then CVS was one of the partners that start all these conversation from the beginning. Then that was the reason why we start conversation. I have to say about the partnership, it's a process, and sometimes it's not happening in a month. And you need to go and you need to talk and you need to show and you need to express your interest, and they need to realize that you are just taking seriously the partnership and the whole idea. And I have to say, CVS, we are very happy with them, and they are very happy with us because we built this relationship for more than 3 years, almost 4 years. Then this is part of the process. It's a process, but it's possible because right now with the grant, we have the opportunity to work with other partners as well, and it's a process, but you can make it, definitely.
Thank you. Thank you so much. Before we move on to our next segment, I just have a question for Susan and Amita. You know, listening to John and Betsy this morning, you know, hearing about the credentials and portability and things of that nature, do you have any reflections that you'd like to share or any thoughts based on, you know, their presentation?
Yeah, I think that that can be one of the greatest luxuries and one of the greatest challenges for graduates, that if they decide to move to a different state or a different region of the country, can they take their license and with experience do a reciprocity where they just apply to the state based on their first license and their experience and move right into the new opportunities. Oftentimes, depending upon the profession that you're in, that doesn't happen due to state scopes of practice. I'll share with you, I'm a dental hygienist by profession, and we probably have one of the most restrictive state practice acts or differences in state practice acts. It was only just a few years ago that we went to a regional credentialing examination, and we're still taking a clinical board. It's now in a non-patient, but now in a mannequin. But really, when you talk about accountability and you talk about getting through credentialing, it can be extremely challenging and costly. And you're going to find that the portability of other professions at a mid-level and entry level are going to be much or facilitated in an easier fashion, depending upon that profession. So yeah, that's something that we continue to work on because scopes of practice are different in each of the regions. You know, I can share with you that for years, I practiced in New York City and was able to provide a specific type of care, but here in the state of New Jersey, I wasn't, unless I went back for additional education, which was just silly. And then the New Jersey State Practice Act changed it, and now I can perform that if I choose to. So, you know, there are a lot, when I said at the beginning that there's a lot of partners in this circle of students deciding they want to enter a profession, going through the educational process, getting through the credentialing, and then moving on to license and, you know, recognizing the scopes of practice in each of their practices.
Okay, thank you so much. We're coming to the end of this segment. I'm just going to ask one last question because I think it's important. Does CVS provide any feedback to you if an individual does not get hired as to the reasons for not selecting the person?
Yes, when they are not hired by CVS all the time, the successful coach get information from the CVS team partner and then start working with them. As I mentioned, they allow them to take their application process or go through their application process after 2 months they apply and they are not passing the application. Then sometimes the students decide just to work better, just to go over some specific pieces, and the successful coach is just organizing some meetings with the student to help them and guide them and have them ready in the areas that they were weak the first time, and then they pass the second time and they get a job. But if it's not, as I mentioned, we have partners asking for these students, and the successful coach is in contact relationship and connection with the job placement manager, and he will be helping them as well.
Thank you. Thank you so much. And I love to see both sides of the house. We have our credit and our non-credit together, working together when we talk about credentials, right? And that in itself is a wonderful partnership. So thank you both, Susan and Maida. We really appreciate you joining us today and talking about this great partnership.
Thanks for having us.
Thank you for the opportunity.
Absolutely. And so this leads us to our next segment. One of the recurring themes we've heard today is industry, input from industry. We need to have partners in the business community. And so our next segment is on the insights on current industry trends. So you heard Michelle from NJBIA earlier mention it, and we talked about it last week. We engaged our industry leadership teams for each sector. So if you look on the PowerPoint right now, you can see some of the amazing industry and business partners that we engaged last week to talk about what's happening in the industry. I'm not going to read through every one of them, but in health services, I just want to note that we really wanted to get a great cross section of the sector focused on. We have hospital partners, we have people from the disability community. We have even Horizon Blue Cross Blue Shield there, looking at different aspects, mental and behavioral health, because we don't want to miss any part. We all know that health services is a tremendous sector, but we want to make sure that we're focusing on each and every part. So we wanted to get a good cross section through our industry leadership team. So we convened this industry leadership team in the presence of NJBIA as well as NJCCC. And so we started with this slide that you see here, health services in New Jersey. What we did is we took some of the labor market information that we presented, some other industry intelligence, and really put it into these 4 buckets so that we could really look at what's happening in health services in New Jersey. So I want to just go over some of the trends and challenges that we see on this, and then also give you some of the feedback that our industry leadership team either supported or refuted based on this, this slide. So one thing that, we'll start with trends. We see that more health services workers are now employed in ambulatory healthcare centers than in hospitals. This is tremendous. I even see it in my local community, and I'm sure a lot of you as well, that all of these ambulatory healthcare centers are popping up throughout the state. And I mentioned before, societal attitudes are now placing, and it's wonderful, a greater emphasis on mental and behavioral health. We see it across our community college systems, and we see it in the industry. Technical and technological advances and innovations, something that we all learned very quickly with COVID. It really sped up the different technological advances. We see a lot of things happening and changing, not only in health services, but across all sectors. So everyone really supported what we were talking about as far as trends. And as we got into opportunities, we see again this technological advances. We now have this rapid adoption of telemedicine and telehealth, right? However, when we move over to the skills and credentials and we talk about challenges, one of our industry leadership team members mentioned that this could also be a challenge. It's been a challenge as well. I think we all learned quickly how to use Zoom. How many times do we say, oh, you're on Zoom, or you're on mute, all of those things. So it's not just, and think about that in terms of telemedicine and telehealth, meeting with your doctor online. This is an overarching opportunity, but also a challenge. And I'll talk a little bit more about that in a moment, but the aging of the state's population is really going to put a strain on our healthcare system. Today, we talked a lot about apprenticeships. We talked about an apprenticeship in pharmacy tech, and typically apprenticeships were not really thought about in the healthcare industry. So we're really excited about the HealthWorks grant. We also talk about mentorship. So with all these opportunities, we have room to expand these apprenticeships, and the apprenticeships that we're seeing in the healthcare have been amazing. And to me, when growing up, I never thought about apprenticeships in healthcare, right? We thought them traditional in the trades. So it's wonderful to see, and it's really helped with retention. The challenges are many. One of the biggest challenges is New Jersey's health services sector faces an aging workforce. We see it across the state. So the number of workers over 65 has tripled in the past 20 years. There has been tremendous employment needs in the long-term care due to aging population and retention. One of our members of the industry leadership team brought up a survey that said there is a 48% exit rate in nurses projected over the next 2 years. If you think about that 48%, the seasoned nurses are really needed for the onboarding of new nurses. And so there's going to be a tremendous gap of those seasoned workers, which continues with the worker shortages, retention, burnout. We have been burnt out from the pandemic. Think about the healthcare industry. And so one of the things that's a challenge when we talk about this is that the new generation that is coming into the workforce, they're looking for different things. They want to see flexibility, right? People are wanting to work more of the gig economy, per diem. They want to create different types of schedules and roles. They don't want to work a traditional 40-hour work week. And this is particularly difficult in healthcare because if you're in a hospital setting, you need 24/7 care. We can't have a gap in the time of care. I can't dictate my schedule. So this has been an issue. And then prohibitive training costs, lack of advancement in the pathways, making entering and growing in the sector difficult. That is one thing that we are working on with our pathways work and through this initiative, really looking at those challenges, how to afford using some of the things that we have that we're eligible for, community college opportunity grant programs, things of that nature. So we're really going to incorporate those in the center's work. And then I just want to talk a little bit about skills and credentials. We keep hearing essential skills, problem solving, critical thinking, adaptability. We think about this in terms of, we call them essential skills, but so many employers, that's all they say. I can train someone. If someone comes with a credential, we know that they pass that exam. But one of our partners, which I thought was really interesting, and it kind of speaks to what Betsy was talking about earlier today, was that patients need warmth and compassion. These employees, they're saying, are not able to provide that warmth and compassion. One of the other things, huge lack in writing skills, saying that some of the students coming out of nursing school are unable to chart in their charts, and that poor communication skills. So not being able to work as a team. And I think truly this pandemic has affected the way we work, right? We're used to being alone in our house, working on a computer. The collaboration has changed. Even for students, not being in a collaborative environment, you're missing a piece of, what we had maybe 5 years ago. And then really to wrap up, as far as diversity, equity, inclusion, all of our industry leadership team, we spoke about that, especially in patient care. It's important to diversify the workforce. And I talked about computer skills as well. And so each quarter, we have another industry leadership meeting in June. We're going to talk to our leadership team. We're going to come back to this group and really present to you and give you an update on what's happening, what's trending, what's changed in the last 3 months. And so we really look forward to engaging our industry leadership team, as well as relaying this information to you. So our next segment, I'm going to introduce Catherine Stargill. And Catherine is going to be speaking about comprehensive cross-education sectors pathway models. So Catherine?
Thank you, Sandra. Appreciate that update from the industry leadership team. Hello, everyone. I just want to go over very quickly to explain the approach of the work that's happening in the Centers of Workforce Innovation. Clearly, this collaborative meeting is part of one component of our New Jersey Pathways to Career Opportunities initiative. The second component is are the Centers of Workforce Innovation. There are 10 focused on occupational areas under the 4 industries of focus for each of the collaboratives. So the Centers of Workforce Innovation are smaller groups then these collaborative groups, which are all-inclusive, statewide convenings, where we're sharing information. In the Centers of Workforce Innovation, right now, the community college partners are preparing work plans and budgets to outline their work. And the basis of that work really is to create pathways for their existing degree programs so that there are no dead ends. There are many on and off ramps to anyone's education, traditional students coming straight from high school, as well as adult learners who maybe are taking workforce development courses that have historically been non-credit. We are working in the centers with the community college partners and soon some of you all to ensure that our pathways are connected at every level so that every course that anyone takes toward industry valued credentials or upskilling will in fact result in some college credit. And that will help all of our residents move closer to achieving our credential goal for the state, which is that 65 by 25. 65% of the population or residents in New Jersey receiving industry value credential or degree by 2025. So this is the pathway model that we are implementing in those Centers of Workforce Innovation. And here is another way to look at these comprehensive cross-education sector pathways. We want to make sure, and we are enhancing existing career degree programs at the community college to ensure they are linked to high school curriculum and dual enrollment agreements to ensure that industry value credentials or even traditional college courses, general education courses that high school students are taking while in high school, but connected to community colleges, are for community college credit. And if at all possible, we like to link that experience for the high school students to experiential learning opportunities. And then of course, at the community college level, we'd like to embed more industry valued credentials in degree programs to ensure that, in fact, once a student completes an industry valued credential course and takes the exam, they can put that credential on their resume, which makes them ready for employment. The same would happen at the high school level if those dual enrollment agreements incorporate industry value credential courses. We know that the vast majority of our student populations in community colleges work and learn. So if we embed more and more industry valued credentials that simply by adding to their resume, it makes them, the students, employable, that is an added plus for the student body. Of course, we are in the centers enhancing those 1+1 transfer agreements, such that community colleges that maybe don't have a particular major area, in fact, can offer their local students general education courses, but then pass that student off to other community colleges that have the degree program of focus that the students are interested in. And again, we'd like to bake more experiential learning opportunities within our degree programs. Also, within those centers, we have four-year colleges and university partners, and we want to make sure that we are maximizing the transferability of community college credits. We all know that the Lampet Law requires that all community college credits are transferable to public four-year colleges and universities within the state. However, sometimes there is not a direct matchup between the majors in the community college, those degree programs, with the corresponding degree program in the four-year colleges and universities. So we want to link up that curriculum to ensure, in fact, that the 2 years that or the year that the community college student spends with courses focused on their major, all of those credits transfer to the four-year colleges and universities of interest and focus, or that they are transferring to. And in fact, we've received very positive feedback and engagement from four-year colleges and universities on this. Certainly, we would like to increase the 2+2 and 3+1 transfer agreements where community college students spend 2 years at a community college, gets an associate degree in 2 years at the community college. Or I know Rowan has the model of 3 years at a community college and just 1 year at Rowan University. Those are examples of agreements we would like to increase and directly link to existing community college degree programs. Always interested in ensuring that there are more experiential learning opportunities included even at the 4-year college and university levels. Additionally, we are working toward developing more prior learning assessment solutions so that all students and working adults receive community college credit for either their work experience or for the non-credit industry value credential courses or workforce development upskilling courses that they have taken throughout the state. Because again, we don't want any dead-end training or education. We want all the time any student or working adult spends in a course actually leads to a credential or degree. Also, we know that so many of you all attending this meeting today are community-based training providers, unions, and the like. We want to really link up your programs, your training, such that they equate to community college credit as well, again, to ensure that even your students are on a pathway to a degree from a community college to further their journey towards a degree or credential. And we have several examples of that now. I believe tomorrow during the Technology and Innovation collaborative meeting, if that one is tomorrow, I can't remember. We have 3 more this week. Sandra, is that one tomorrow? Technology Innovation.
Yes.
Okay, we're going to have an Innovative Pathways partnership presentation that involves a community-based training organization that is training, or its courses are effectively toward industry value credentials that get their students on the pathway to employment and furthering their education. So this is just an example of the work that is happening within the centers. And next month, we'll have a report out from the 2 centers in health services. There's a center on patient care, another on healthcare technology and administration, and they are developing those plans and will in fact have a report out with regards to exactly what that work will be. So just wanted to explain what we're doing. I think now we are going to move right to our closing remarks. We really appreciate that all of you all have stayed for the entirety of this meeting. We know that, in fact, it is a heavy lift for you all to spend an hour and a half with us every month. And so we certainly appreciate you doing that. As always, you can put your phone up to this code to scan. It'll take you directly to our website so you can sign up to ensure that you get all the updates as well as meeting notices. Please stay connected to us on our social media channels. And here is a list of our future collaborative meeting dates. Instead of, so many of you all participate in all 4 of our collaborative meetings every month. So instead of taking you up the mornings of your whole week or almost your whole week, we are going to a model where there will be 1 collaborative meeting every week. We're hoping that that will better accommodate your schedule. We know that you all have a day job. We certainly appreciate the enormous engagement that you give to us with this initiative. But that means that in just a couple of weeks, we have our first April collaborative meeting, starting with manufacturing and supply chain management. And then Technology and Innovation is the following week, April 13th. Health Services is the Wednesday, April 20th. And Infrastructure and Energy Collaborative meeting will be Wednesday, April 27th. We will send out our normal blast email invitations to you all with an Eventbrite link so that you may register. We just want to keep you all engaged, and we really appreciate you attending. We will be sending out a survey so that you can give us some feedback. We made a few changes from last month based on your very important feedback from those surveys. So thank you for completing those. Sandra, do you have any last words?
I just wanted to thank everyone. Actually, Lauren put the link to the survey if you want to do it right now. While it's still fresh in your mind, it's in the chat. It'll also be in our email, but thank you again. This was wonderful. I love the excitement and the energy, and we really appreciate you collaborating and partnering with us. So thank you. We look forward to seeing you next month.
Thank you, everyone. Have a great rest of your day.
Have a good day.